From the JAMA Network, this is the JAMA Medical News Podcast, discussing timely topics in clinical medicine, biomedical sciences, public health, and health policy, featured in the medical news section of JAMA.
On today's show, we're discussing some good news for patients with advanced cirrhosis. I'm Kate Schweitzer, Associate Managing Editor of JAMA Medical News. News Director Jennifer Abbasi is here to talk about the story. Hi, Jen.
Hi, Kate.
So this piece was written by freelance writer Linda Rogers. Linda covered a new retrospective study from the Journal of Hepatology that looked at the outcomes of patients with alcohol-associated decompensated cirrhosis who had stopped drinking. So first, tell us a little bit about this condition.
Sure. So it's estimated that 55% of people with alcohol use disorder have alcohol-associated liver disease. And rates of advanced alcohol-associated liver disease have more than doubled in the U.S. in the past 20 years. Once people have alcohol-related cirrhosis, they have a high risk of what's called liver decompensation. This is when the liver has become so scarred that it begins to fail, which can cause symptoms like ascites, which is fluid buildup in the abdomen, as well as confusion, gastrointestinal bleeding, and ultimately death. It's been thought that liver transplant is the only option for these patients, but in recent years, abstaining from alcohol alongside treatment for symptoms has been shown to improve the prognosis.
So how does the new study add to what's known about the outcomes if people are able to abstain from drinking?
Well, the new study really quantifies the benefits of quitting drinking for these patients. The study looked at the health records of more than 600 patients from 17 hospitals, many of them transplant centers in Asia and Europe. The patients' median age was 55 years, and they all had quit drinking alcohol after being diagnosed with decompensated alcohol-related cirrhosis. The authors found that over a median follow-up of 3 years, about a third of these patients achieved hepatic recompensation, meaning their livers functioned again and their symptoms of liver failure resolved. And none died from liver-related causes in that time frame or developed hepatocellular carcinoma, a type of liver cancer that's associated with cirrhosis. These patients also had a lower risk of death from any cause than those who did not achieve recompensation.
And what were some of the key factors associated with liver recovery?
Yeah, so patients who stopped drinking completely within the first month of being diagnosed with decompensated cirrhosis had a higher likelihood of achieving recompensation. And so did patients with fewer complications of advanced cirrhosis, only ascites instead of ascites and a bleeding event, for example. The third factor was that the patients with hepatic inflammation had a higher likelihood of liver recovery. Now, this might seem counterintuitive, but the study's authors explain that what's probably happening is that these patients still have some liver tissue left that can be inflamed, and that can also regenerate.
Now, it's important to note that although the study's findings do offer hope for patients with advanced cirrhosis who abstain from alcohol, 2/3 of patients did not achieve liver recovery, even though they stopped drinking. And the experts Linda spoke with said this really underscores the seriousness of the disease.
That's right. But the hepatologist she spoke with said that the 1 in 3 chance that people with alcohol-related decompensated cirrhosis may have of liver recovery is an important statistic for clinicians to share with their patients to encourage them to completely abstain from alcohol. The study's authors also said the findings highlight the need for long-term multidisciplinary care so people with cirrhosis can quit drinking for good.
Thanks, Jen. If you'd like to learn more, we'll include a link to the story in the show description. This week, we also published a story about a new federal initiative in the U.S. to increase the amount of nutrition training medical students receive. More than 50 medical schools have committed to introducing 40 hours of nutritional competencies for students starting this fall. But one of the questions the story looks at is what those competencies should be. You can find that in all of our stories at jamamedicalnews.com. Thanks to Jen Abbasi for joining me. I'm Kate Schweitzer. This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening, and join us again next week.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.